Ms. Brown?
Oh, yes, thank you, Undersecretary Vanderpool. Vanderpot?
Pot. Yeah.
Pot. Okay, Vanderpot. Wanted to ask the question, first of all, thank you so much for your presentation. Thank Secretary Inslee for her presentation as well, and each of you that are here today. Wanted to ask the question about long-term care for vets. And I want to ask that because, first of all, I am the chair of aging and long-term care, so this kind of falls under our purview. Wanted to ask you, what do you do, or what does CalVet do to help veterans stay in their home? And the reason I say is you have nearly 2 million vets in the state of California. You only have room for 2,500. What happens to those who just don't have any place to go?
So let me answer your last question first about what happens to vets that have no place to go. You're right. The homes only have a finite amount of beds, and typically there may be a short wait for DOM care, domiciliary care, and a little bit more at skilled nursing. So at the point, we can do our best to admit them, and it's rather interesting because we do have 8 homes, and California is a big state. And if you're in Chula Vista and you can't get in the home, but we can offer you a place in Barstow, it's really up to the family and the veteran if they really want to make that move. And what we try to do is strive to get them into our system and then help accommodate their family needs by bringing them down to Chula Vista once that particular bed would be open, for that example. So we try to work with the families, and then if not, then the families, we try to connect them with either nonprofits or other entities in the communities that could potentially help them find locations for their loved ones. So
there's nothing in place to help a vet stay in their home?
Again, I run the homes once they're in the homes. I think that perhaps
somebody else can answer that question.
Yeah, thank you.
Okay, no problem. I just wanted to know because long-term care is an issue that we're going to be facing, and we're facing right now because of our aging population. So, thank you.
Mr. Frazier, did you have a question?
Thank you, Madam Chair. I understand that the acting secretary had visited Yountville, and I had a meeting with her previous to going. And JP and I have had these discussions with Yountville, and I haven't had the opportunity to visit any of the other facilities, but we have conditions there that have been not ignored, but just not been able to been fixed, or like the kitchen at Yountville where the roof was leaking, and they have no opportunity using their contracting out services instead of utilizing the facility. There's also some of the facilities that aren't being utilized for occupancy. They need to be redesignated and revamped, but there's an opportunity for capacity there. What are your plans moving forward? And Yountville is not in my district. It's just that we had an opportunity to tour the wonderful facility, and the people there are just absolutely pleased with the level of care. But my concern is, again, facilities and maintenance going forward on Yountville.
Yeah, thank you for your question. So Yountville is quite a unique campus. It's 500 acres, and there are buildings there that right now are currently vacant. I think to best answer your question, though, I kind of like to pull back and just talk about Redding and Fresno. Redding and Fresno are these state-of-the-art homes that offer veterans a room to themselves and a bathroom to themselves. And if you've gone into some of the rooms in Yountville, you'll find that they're woefully small, typically 250 square feet with 125 square feet per veteran. And it's the old-fashioned military thing where it's a bathroom latrine down the hallway. So, quite honestly, and it's usually typically 2 people per room. I think what we need to do is step back and examine what our needs are going to be in the future, say 5 years from now. And I agree with Member Brown that long-term care and the needs of that need to be examined in the sense that where are veterans entering care? And, much like the civilian population, many are waiting to the absolute last minute. They want to stay with families. They don't want to be institutionalized. And so as we build, what we probably need to think about is what we need is more skilled nursing at the higher level, and that would cause renovation in much of Yountville for that. And also for those that are in independent and assisted living, well, let's offer them the dignity of having a private room to themselves as well. I know last year we had, I think it was last year or the year before, there was a master plan that was released for Yountville. But I think that it's worthy to relook that with an eye of where we want to be 5 or 10 years from now and the type of care, across the state, quite honestly, that we need to offer for our veterans. Because there isn't much of a wait to get into dom care and assisted living just for the reason that I explained, but the need is much greater in the skilled.
I had just a couple of questions. Following up on what Mr. Matthews said, talked about the star ratings. You mentioned that you're looking at keeping metrics and changing administrators. Are there other initiatives that are being taken on, and how long before we will really see a change in the way these homes are run?
Well, interesting question. Okay. So Barstow had a CDPH survey last week, which went remarkably well. And there's potential there to see an upgrade of the star ratings. I think, to look at all of the star ratings and the reasons the homes are down to 2 is different for each location, and I think, yes, examine the core reasons for that comes from the metrics, and that's one of the reasons why I wanted to look at the metrics. And excuse me, and like I said, we are looking at the appropriate staffing standards, the appropriate level of care, just a really kind of across the board look on how we're establishing our quality of care.
All right, thank you. And then I had one other question about the reform legislation, about the MWRs.
Sure.
And the reform legislation, and there's still the BSA investigation out there. So what plans does the department have to, if any, to deal with the issue of those MWRs?
Well, the Morale Welfare Fund, I just want to make sure that all the members understand what the MWR fund is. In general, does everybody know what it is? Okay, I know, yeah. So the MWR fund was audited in the Yountville home back in 2013, and from that were several recommendations. And then last year, Member Yamada had a bill out of Yountville that was helped kind of reform it and offered some to kind of consolidate and centralize some of the management, and also to tighten up on the procedures for actually contracting and visibility at the headquarters. Unfortunately, the bill was killed, and so what we plan on doing is revisiting that, and I believe Senator Walk from Yountville is looking at relooking a bill this year for MWR. And in the meantime, obviously, the headquarters has established quite a few policies. We worked with a team from the Department of Finance to really hone in on what some of our needs were from an accounting perspective and from a contracting perspective, and we've taken that and we've built our own procedures for that, and we're instituting those now.
All right, thank you. Mr. Matthews?
Just going with the last one, I mean, we've talked about the different things that are going on, the different problems that you guys are faced with. How is it that, as a legislator, how can we help assist and move forward with these things?
Can I get a bit more defined of what you mean by these things, please?
With the MWR, with the homes, there's several different programs that we're looking at that do need, more funding, other things helping with the programs. What are there particular issues? I mean, what would be your top 3, top 5 that you would want prioritized for us to work on moving forward?
Okay, thank you. Well, first off, again, as the Secretary mentioned in her testimony, thank you very much for the $700,000 that helped kind of push the kitchen forward. I mean, that in itself is quite a help. So now, to build a home without a kitchen is kind of a unique phenomenon, and now at least we'll be able to correct that in the next year. On the MWR, I think perhaps in education throughout the whole assembly on exactly what MWR is and how it benefits veterans, I think would be relatively helpful, and perhaps an understanding of how the language within the code itself needs to be modified to better support our current needs for veterans. That would be an area of interest for me. And then we are looking, as with the metrics and the quality of care, and we'll start working on staffing, and we'll probably work with Department of Financing to make sure that we are staffed appropriately for our needs and care in the future.
Assemblymember Breaux.
Thank you, Madam Chair. Madam Undersecretary, thank you for the service in the Army. Go Army. And thank you for your service now at the department. Question about Prop 41, the homeless housing program that was approved by the voters.
If I may, I think that would be better served for Deputy Secretary Gunn.
Okay.
Yeah.
We'll hold off on the question then.
Thank you.
Do we have any other questions? All right, thank you very much. And then our next speaker will be Deputy Secretary Tremblay.
Thank you, Madam Chair. Good afternoon. Thank you all for allowing us to be here and to present. Appreciate the opportunity here. First, I want to echo what the Secretary had said, thanking the legislature and the Governor for the strong support that has been provided to CalVet as we are expanding our operations, expanding the homes, and expanding services and vet services. The one thing I've noticed here, and I've been at the department 9 years, I think, going on 10 years, veterans issues are a bipartisan issue. There is no one side or the other. People all want to stand together to help veterans. And that's one of the things that I really do appreciate about this agency, about this committee, and about this issue. I want to touch on one subject that I know some of you we've talked to about before for your awareness. We have been talking about an update and rewrite of the Veterans Code. The Military and Veterans Code in our state has been in place since 1946, hasn't really been updated since they brought all the various pieces together, the homes, the Veterans Benefits Board, and other pieces together in 1946 after World War II. We have to go back and update that and bring it up to today's standards and look at what is still needed and make sure that it's working, and what is no longer needed, we'll take those pieces out and continue to work on that. But as you can imagine, it is a large and complex process, and it is going to take us some time. We're continuing to work with our stakeholders, and we will continue to work with our stakeholders. But I just wanted to let you know at this point we're looking at probably next year before we get any kind of legislation that would go forward with this, because we still need to have more clarity on what kind of structural foundational changes, as the Secretary was mentioning, we need to address. So we're working concurrent with that to examine our Veterans Code to make sure that it is up to date and does meet the needs of the veterans from all the various generations of veterans, going back now to those that are still from World War II, Korea, Vietnam, and on through the current conflicts that we have. Real quick summary of what our department does. I'm here to talk a little bit about just the administrative operations of the department. As the Secretary mentioned, we have $394 million as our budget, but of that, $326 million of that is out of the general fund. The Farm and Home Loan Program, their operation is about $56.7 million, but that's all self-funded through a self-liquidating. They basically pay for their own operations through the operations of the Home Loan Program. There are other various funds that make up the small difference, but that's pretty much the bulk of where our money comes from. We do get, as part of the general fund, we do get reimbursements and other costs and revenue back from the U.S. Department of Veterans Affairs for per diem, as for those residents that are living in our homes. We also get insurance payments and other things for benefits or services that are provided to the residents in those homes. So the offset, there is an offset each year from some revenues coming in on that general fund cost. We have about 3,400 or 3,047 authorized positions right now in this current fiscal year. They're in the 8 homes, 3 veteran services districts, the 2 cemeteries that we have currently, and one that is on the building blocks, but I'll let Keith talk about that, and through our headquarters building. Our department basically is a connector for services. Our job is to be the advocate for veterans here in California. We work closely with the U.S. Department of Veterans Affairs and with our partners in the community, specifically the CVSOs, the County Veteran Service Officers, are an important key element of our efforts to reach out to veterans. We also work with nonprofit and community-based organizations to connect veterans to their earned benefits. We have multiple programs that will all be discussed and outlined here shortly. The department's mission is focused, and that is our mission for all of us, is to serve the California veterans and their families. We want to make sure that when they call us, we can help them find the information that they need. As the point that the Secretary mentioned briefly in her comments, the need for a service center and to be more customer-centric and customer service-oriented. One of the things that she wants to do here right off the bat is to establish a service center, a one-stop shop, if you will, where people can come in, a veteran can come into our headquarters building and find information about anything that they would need that might be from either the U.S. Department of Veterans Affairs, mental health services, whatever, within state government. They can come in there. If a veteran's looking for information, we can help them find it. That's the vision of what we'd like to do for those customer service centers. As we get those going, if we can expand it further, then great. But we will recenter and focus the divisions and the departments to be focused on our customers, the veterans and their families. So we're continuing to move forward with that. We're continuing to work to serve the veterans in our state. And with that, I'm open for questions, or I'll turn it over to the next speaker.
Do we have questions from the committee? Assemblymember Chavez?
So you're going to have a customer service center over there in the headquarters?
That's one of the things that we are looking at, yes.
Why?
So that any veteran...
Well, let me answer, be more specific, so because I heard what you just said, but I'm trying to put it in my brain. You have, 70% of your veterans in Southern California?
Mm-hmm.
It's a very small amount up here. California Department of Veteran Affairs headquarters is designed to oversee projects, programs across the state.
Right.
So that sort of activity, customer service centers, are actually done by the county veteran service officers in other counties?
In many cases, yes.
And so does Sacramento have a county veteran service officer?
Yes.
Do they have an office in Sacramento?
Yes.
So there is a place to do something like that.
And one of the things that we're looking at is bringing in some CVSOs to work with us and help. This is an idea that we're looking at, how we can improve the services for the veterans. And the one here at headquarters, we have to start somewhere. And headquarters is a place to get started. And if it works well, make it work, we can expand it and take it to further areas. But at this point, it's a place to begin and to get started. We want to try and make our center, our headquarters, our office, and the department a place where people will go to find information and find services that they may need. And if that brings in partners, those partners with the CVSOs and some of the nonprofits in that same location, a one-stop shop, so to speak, that is something that we can do, then it's something we should look at.
I would disagree. I would say that that sort of thing is great down at the county veteran service officers. A lot of time in counties like San Diego or larger, or Los Angeles, they have outreach at different places to do that. The most important thing that we could do out of the headquarters over here is ensure the quality care of the homes and management, taking care of the farm and home loan program, ensuring that we're getting resources from D.C. to fund these things. I mean, there's a lot of things that need to be done that are unique to the headquarters of the California Department of Veteran Affairs that sort of activity may make you feel good, but it'd be better to have those throughout the counties doing that, and we more have a managerial upward look instead of a individual look. Makes you feel good, but we're at a systemic issue. So for what it's worth, that's my thoughts on that idea.
And please don't misunderstand. I'm not saying that all the service centers would be strictly CalVet-centric. It may be that we do service centers in partnership with the CVSOs, and those, as you say, many counties have good programs out there, and we partner with them. If we can bring in resources there from our staff, if that's something we can look at. This is something that we want to try to do and be more effective in our outreach and in our customer service. And one of the thoughts was to try it here and see how we go forward with that, to improve services for our veterans and their families.
And you've been there long enough to know we've had a number of these programs that start up like the Flavor of the Day, that suck up resources and then die away a year later when somebody moves on. So it's all personality driven. So I would recommend that you systemically look at how everybody fits into this issue, not just the county veteran service officers, not just the federal VA, not just the HATs, but also your community veterans groups that would do that sort of thing.
Understood, sir. Thank you very much.
Assemblymember Mathis.
To go on with Member Chavez's remarks, the one-stop shops are great. It's a great idea. But when you're looking at veterans populations that stem up and down the state, it's how are you providing that to every single different county across the state? How are these things going to be implemented? Is it just the flavor of the day? The other part of this is, what is your plan for outreach? Having the programs are great, but if nobody knows about them, then they serve no purpose. And one of the biggest problems I see, being a veteran myself and of having gone through all of these, is the outreach isn't there. People don't know. And what is your plan to do so?
Well, Assemblyman Mathis, our Deputy Secretary for Vet Services does work closely with the CVSOs and has an outreach effort and program that he will be talking about, which will outline some of that. This was just, my point was just to raise an idea of what we are looking at this point. We are still, there are programs that are going out there for outreach, and I will let Deputy Secretary Moylan address that and fill you in on some of what we're doing.
Okay.
Member Daley.
Thank you very much, Madam Chair. Just a couple questions on the service center. How much space is in concept being devoted to this service center, and how many employees will be assigned to it? How many state employees will be assigned?
I'll let that.
Just to back up a bit, the concept of a service center is something that Secretary Inslee feels very passionately about, and feels that, I think, what's being discussed here today is putting the cart before the horse, and on many levels. But as far as the details of that,
Is it too soon to say?
it certainly is. But more so, and back to Member Chavez's point, you know more than most, Member Chavez, the structure over there and how it's set up. I think a lot of the emphasis put on a service center, I guess perhaps at this point that might not even be the proper name for it. But unfortunately, well, fortunately and unfortunately, plenty of veterans come in that building expecting to have their needs met when they come in. Clearly, that's not how it's structured. However, it would be beneficial on some level to have any immediate needs met that folks have when they walk in. Obviously, the first step is often a referral to the Sacramento County Veterans Service Office, which is the usual protocol. However, there are some things that I feel CalVet needs to be prepared at least to address on the spot, when perhaps that referral and sending them down the street might not be the most effective way to deal with the issue that veteran has at that moment. So to call that a service center or whatever you want to call it, but to have something in place that can meet the immediate needs of veterans when they enter that building, expecting to be provided certain services, and managing those expectations, but also providing them the proper resources and referral to appropriate place.
So it's fair to say that this is a concept that is being studied in response to a perception of some benefit. There may be some benefit to some veterans, but you haven't thought, but all the details are still in the planning stage.
Correct, sir.
All right, thank you. Thank you.
Do we have any other questions for Deputy Secretary Tremblay? Yes, Mr. Mathis.
Going back into these one-stop shops, how familiar are you with the community college system trying to develop veteran centers on their campuses, and is there any role that you're having to play in that along with these lines?
We do have those, and Deputy Secretary Boylan's division is the one that works very closely with the community colleges on the development of those and works with them on those programs.
Now, is there a plan to pair up VSOs with those? Because I know there once was.
If we can, like I say, I'll turn it over to Deputy Secretary Boylan at this point, unless there's other questions specifically on that. Because his area, we're kind of bleeding over into his area quite a bit.
Are there any other questions then for Deputy Secretary Tremblay? All right, then thank you very much for your time, and we will turn it over to Deputy Secretary Boylan. Thank you.
Thank you. Well, I appreciate the opportunity. As many of you know, I relish any opportunity to speak of what we're doing in vet services, so I am here today to, I know you got some documentation. I think you just received it, so I was going to kind of just hope you'd seen that and had some questions for me, but I won't get too into the weeds on some stuff. But I guess I'll start with a quick overview. JP touched on some of it. We're set up in headquarters building. We operate 3 district offices, one in Los Angeles, one in San Diego, and one in Oakland. In addition to the cemetery system, which one cemetery in Igo, one at the Yountville home, and one that's March 13th, we're having the groundbreaking down in Monterey for the California Central Coast Veterans Cemetery. So as many of you know, that has been a process that's taken more than a decade, so we're very excited to get that through in this past year and get moving on that. Just a couple quick highlights. We recently signed an MOU with the California Department of Corrections to allow vet services staff to go in and provide direct outreach to veterans and start developing a program. So when incarcerated veterans are near their time to get out, we receive all the information from CDCR on the veterans currently incarcerated with their estimated time, their estimated exit date. So we connect with them prior to that and address any needs in terms of their comp and pen and so forth, and get them hooked up with a community service of care around them, including the County Veterans Service Office. So we're very excited about that new endeavor. The Vet Rep Academy, that's something that years ago, I think the concept was born, but over this past year, we kind of put pen to the paper on that. It's a process that allows a training program for our county veteran service offices to ensure that they all have the same base structure of knowledge, and then that's coupled with continuing education units that they're required to take in order to maintain their accreditation with CalVet. We're very excited about that. Early returns have been very positive, so we'll look at that moving forward. And then, of course, we've been embedded within the USDVA system with our strike teams for the better part of 18 months, and I've had some significant successes there. So we're very excited about those initiatives. CalVet Vet Services covers a lot of ground, so any particular areas you want to jump into, just cut me off. But it oversees the California State Approving Agency for Veterans Education, which is the part of my division that works closely with private and public, for-profit, nonprofit, post-secondary institutions in order to certify them to receive GI Bill benefits. We oversee the Disabled Veteran Business Enterprise Program, which is a state program which has an allotment for 3% goal for disabled veteran business enterprise on any state contracting opportunities. In addition, we do have our LINK network, which is a local interagency network coordinators. We have 8 that are stationed throughout the state in different regions, and their responsibility is creating kind of a hub and spoke system within the community and connecting all those community-based service providers together, making sure everybody knows what everyone else is doing in that community. So regardless of where a veteran's entry point is into that wheel, they inevitably make it around to the point they need to get there, whether they enter through a faith-based organization, through the CVSO office, through a community college veteran resource center, or wherever that may be. So back to your question a little earlier, we work very closely with the community colleges and the development of their resource centers and surveys and so forth in terms of the need on campus. In addition, we work very closely to connect them with a community-based system of care within that community where they're located, so whatever issues that pop up in that veteran resource center that they don't feel they can necessarily address, they know the provider in the area to reach out to and to refer that veteran. So